How to handle a family member who is bipolar. It can be difficult to care for a family member who suffers from bipolar disease and requires tolerance and compassion. Supporting your family member, looking after your physical and emotional needs, and learning about bipolar disorder are all crucial while dealing with a family member's illness. Section 1. Providing assistance for a family member. 1. Recognize that certain actions in certain of your family members are related to the condition. For instance, it's common knowledge that someone who is boasting or droning on about how great they are is arrogant or self-centered. This conduct, along with other risky behaviors that may be as undesirable to you, is an indication of mania in a person with bipolar disorder. Understanding that this is a sign of the sickness rather than your family member's deliberate behavior will help you better comprehend how they are feeling. Be careful not to mistakenly attribute to a family member's illness every mood they experience, as persons with bipolar disorder are still capable of being angry or depressed in healthy ways. Asking about their experience can help you better understand their sickness and demonstrate your support. Nevertheless, before you try to engage them, use caution and ascertain whether they feel safe speaking with you about it. If this seems too dangerous, just ask them how they are and learn more about what they are going through right now. 2. Assist your family member in receiving therapy for their mental illness. Being supportive of your family member's treatment is essential because bipolar disorder is best managed with medication and counseling. Participating in the psychotherapy of your loved one is one way to get involved. An effective tool for supporting someone with bipolar disorder is family therapy. Talk to the person who is caring for the mental health of a member of your family. If your loved one gave you permission to communicate with their therapist or doctor, you can do so as long as they signed a release allowing you to do so. Also, you can learn more about how to help your family member. You can encourage or assist a member of your family who is not already receiving mental health care to do so. The American Psychological Association, APA, and PsychologyToday.com are both good sources of information. You might look for therapists or psychiatrists who focus on bipolar disorder in your area. But, be cautious not to press therapy on your family member if they are reluctant to do so, unless they pose a danger to herself or others. Doing so could scare them away and strain your relationship. 3. Assist in tracking drug compliance. While the high of mania might seem pleasant to those with bipolar disorder, it is typical for them to skip their medication. As soon as you become aware that a member of your family has stopped taking their medicine, you should contact their doctor or psychiatrist. The doctor will probably want to speak with your loved one and will let you know what to do next. If you can't talk to a doctor, you can persuade your loved one to take their meds or offer rewards, such special treats or time spent with them doing something they like, if they agree to be medication compliant. 4. Follow a medicine schedule. Don't forget that following a prescribed medicine schedule doesn't always come down to deciding whether or not to take a tablet. The most common side effects of medications for bipolar disorder include forgetfulness, tiredness, gastrointestinal issues, excessive perspiration, significant weight gain, hair loss, skin rashes, sexual difficulties, and other unpleasant and disturbing symptoms. Asking about the reasons behind someone you care about stopping their medicine or expressing a wish to stop taking it could be useful. Beyond simply saying "I'm feeling better and I don't need it," they may very well have strong justifications. Some could assert that they appreciate the euphoric sensation associated with hypomania and don't want to take medication that will diminish it. Although adverse effects can happen at any point during therapy and can cause the patient significant pain or discomfort, they are most frequently seen after starting a new medicine or raising the dose. Encourage your loved one to speak with their doctor if they are not taking their medicine as prescribed because of side effects to see if the problem can be reduced to a manageable level by changing the medication's strength or schedule of administration. 5. Provide support throughout a manic or hypomanic episode. It is vital to involve your family member in harm reduction if you see indications that they might be having an episode. To lessen harm when engaging in dangerous behaviors, bargain, gambling, excessive spending, drug abuse, reckless driving. To prevent the antics from upsetting them, keep youngsters, individuals with disabilities, and other vulnerable people away. If your loved one is in danger of hurting themselves or others, speak with their doctor, or call an ambulance or a suicide hotline. 6. Make a crisis plan. To effectively de-escalate a crisis, it is critical to have an emergency action plan. Include the phone numbers and addresses of critical family members who can aid, along with medical and hospital information. You should always have these numbers with you and write them down rather than just keeping them on your phone in case the battery dies, such as in a wallet or purse. Give a member of your family a copy. When your family member is in a stable emotional state, you may even create this strategy together. 7. Assist your loved one in avoiding triggers. A manic, hypomanic, or depressed episode would be considered a negative result in this case, and the activity or circumstance would be considered a trigger. Substances including caffeine, alcohol, and other narcotics are potential triggers. Negative emotions like stress, an unbalanced diet, erratic sleep patterns, sleeping too much or too little, and interpersonal disputes can all act as triggers. Your loved one will have unique triggers that are only they. You can assist by preventing your family member from indulging in these activities or by assisting them in setting priorities for their tasks in order to lessen stress. Common bipolar triggers are criticism and criticizing individuals. You could ban things like alcohol from the house if you live with a family member. You could also make an effort to create a tranquil atmosphere by managing the lighting, music, and energy levels. 8. Show kindness. You might be more accepting and understanding of bipolar disorder as you gain more knowledge about it. Even though dealing with this disorder in the family may still be difficult, your compassion and consideration will go a long way in helping your family member. Just letting your family member know that you are there for them and that you want to help their recovery is one approach to demonstrate your concern. If they wish to talk about their disease, you can also offer to listen. Taking care of yourself in Part 2. 1. Develop empathy. To better comprehend your family member's conduct and to calm your unfavorable feelings or reactions regarding their mental health, try to put yourself in their position. Imagine what it would be like to wake up one day not knowing if you would be thrown into a deep sadness or thrust into a frenetic state of energy. 2. Think on your own mental well-being. Stress and depression symptoms can occasionally result from providing care for a loved one who has bipolar disorder. Remember that maintaining your own physical and mental well-being is a prerequisite for starting to assist someone else. Recognize your own actions and the underlying thoughts you have towards your relative. Give over the reins. It is crucial to recognize this and constantly remind yourself, verbally or mentally, that you have no influence over your family member's actions. You are unable to change their condition. Turn your attention inward and prioritize your requirements. Make a list of your own objectives, for instance, and start working toward them. Use coping mechanisms. Coping mechanisms, which are particular strategies to deal with a certain problem, are essential to self-care. Activities you enjoy, such as reading, writing, painting, music, being outside, exercising, or playing sports, can be used as coping mechanisms. Self-care can also be aided by therapeutic pursuits like art therapy, journaling, meditation, progressive muscle relaxation, and relaxation techniques. Distancing yourself from difficult situations when they emerge is another method of coping. 3. Take expert advice into account. Receiving your own therapy may be helpful if you discover that you are struggling to manage the bipolar illness symptoms of a family member. There is evidence that family therapy, rather than only education, can help people, particularly parents and carers, manage with having a family member with bipolar disorder. Understanding bipolar disorder, third part. 1. Be aware that bipolar disorder has a biological basis. It therefore has a significant hereditary component and is likely to run in families. As a result, it is not your family member's fault any more than it would be if they had a health problem. Your family member cannot manage bipolar disorder solely via willpower. 2. Recognize the various bipolar disorder symptoms. Bipolar I disorder and bipolar II disorder are the two primary subtypes of bipolar disorder. Knowing which type your family member has will help you to better understand their specific symptoms and habits. A person with bipolar I will often have manic episodes that last a week or longer. High/irritable mood, enhanced self-esteem, decreased need for sleep, increased talkativeness, distractibility, increase in goal-directed activities, and participating in risky behaviors are some signs of a manic episode, such as gambling or having unprotected sex with multiple partners. At least one major depressive episode and one hypomanic episode are indicators of bipolar II, similar to a manic episode, but less severe and can last as little as 4 days. 3. Know the treatment options for bipolar disorder. Typically, medication and treatment are used to treat bipolar disorders. Lithium is a mood stabilizer that is frequently used by psychiatrists or general practitioners to treat bipolar disorder symptoms. Individuals with bipolar disorder frequently receive help from psychologists, marriage and family therapists, MFTs, and other clinicians in managing and living with their symptoms. Cognitive behavioral therapy, CBT, family therapy, and interpersonal therapy are common forms of therapy. 4. Learn more about how bipolar disorder typically affects families. Family members of people with bipolar disorder may feel burdened and exhausted. Moreover, spouses of those with bipolar disease may lack support, and many of them choose not to seek assistance. A family member may feel burdened and unsatisfied with the relationship if they think the person with bipolar disorder is in control of their disease. We hope this video has helped you understand more about this disease and how to deal with those who suffer from it, since it affects the patient, the family, and their loved ones. We thank you very much and we wish you the best for your life.